Hello and welcome to ET Edge Insights. I am Poonam Mondal and today we talk about on a very critical topic, that is your heart health. Today we have a very special guest, Sohil Sarkazi. Hello and welcome. Starting off, if you could share what Meril is all about.
Meril has been established in 2007, and Meril is an Indian multinational operating in about 150 countries now. We operate in the space of cardiovascular, orthopedics, diagnostics, wound closure portfolio, which is endosurgery, trauma, and ENT and peripheral devices. So we are one of the companies who has largest portfolio in terms of medical devices in the space.
Okay, if you could share how your R&D has provided the effective and an accurate diagnostic to the patient.
Sure. As a company, we are focused on research. That's been our core focus and competency. We have a dedicated team of over 150 plus professionals who are engaged into research. We've spent a lot of time and energy in researching and developing products which are next gen technology, platforms, technology platforms which deliver cutting edge products for the need that we have in the country and globally. So in the cardiac space, in the orthopedic space, we've been able to come up with novel products that have really been groundbreaking and has changed the way people look at products.
Okay. If you could share how Merrill's MedTech Solutions has provide the help that it's required in the diverse cardiac need and in the regions, especially in the emerging markets, if you could share.
Sure. I'll take this in two parts. So I think as a company, the kind of products in the cardiac care that we brought in range from bare metal stent to a drug-eluting stent, to mechanical valve, to a TAVI, to bioresorbable scaffold. So a wide range of portfolio in this segment, I would say. And we've been constantly working, we continue to work on innovating in this space. So we've ensured, if we speak about India, since Meril came and contributed to the TAVI space, the acceptance and the growth in TAVI has been significant, and we continue to make that effort by handholding a lot of surgeons and ensuring the right education for surgeons, taking their inputs in product development, and at the same time, as you mentioned about the emerging markets, we ensured to create an ecosystem to have people placed into these markets to take forward these products and the portfolio and to reach to a larger audience.
Right. If you could share how Merrill is integrating emerging techs like AI and data analytics.
Sure.
Yeah.
There are two parts to this. We've been able to do this successfully during the COVID pandemic by having and supporting the country's need for testing into the diagnostics segment, and having AI and app-based solutions available for self-testing needs of COVID. We continue to leverage technology in our diagnostics space. We continue to leverage technology in our surgical robotics. That's another big area that we are focusing on. Having our robot launched, the first made in India robot launched this year. I think there are many more lineups coming in 2025, and we definitely believe in leveraging technology across our product portfolios.
All right. So now, if you could share about Merrill's initiative in creating awareness and making an impact.
Sure. I think this is something that I've been closely associated with, and as Merrill, we've committed ourselves to ensure, as a company, if you just make products and make them available, that's half job done. But if you reach out to the people who are the patients and the caregivers and educate them, because India, even at this point in time, 60% is in the tier 2, 3 and so on, and reaching out to them, speaking to them, addressing their fears and their myths around the treatments or surgeries or medical devices is really important. We've launched a campaign which is called as Treatment Zaruri Hai. We are in the third year of this campaign.
Right.
Mahendra Singh Dhoni is the brand ambassador, and we are going full swing with all forms of engagement of patients and caregivers, and inclusive of doctors, whether it is in the orthopedics for knee replacement, whether it is for heart valve replacement, whether it is for bariatrics, whether it is for laparoscopic surgeries. So all the advancements which are available for better patient care and better outcomes, we speak about that. We are largely working and focused on tier 2 and 3 because that's where this is most required.
Right.
And we continue to focus on the campaign. We'll be entering in the fourth year now, and we have a commitment to continue this effort in whichever segment it needs to be, so that more and more people are made aware of what are the better options available for them. They should not hold back and live a compromised life, and adapt and embrace the suggestions and therapies or treatment options that the doctors suggest to them, and live a better life.
If you could share, what are the plans you have, for 2025? If you could share that.
Like I said, we have a platter full of varied portfolio that we are carrying. We are further going to have new segments that we will be focused on, trauma care, specifically into peripheral vascular segment. We are also going to be focused around oncology and various other new verticals that come in. As Meril, we are now a 10,000 people strong team, operating in about 35 subsidiaries across the globe.
Right.
And I think this whole ecosystem, the whole effort that we've put in, is going to be the driving force for Meril to rise as a medtech force from India.
Great. All the best for all the endeavors.
Thank you so much.
Thank you so much for
Thank you.
giving us the time.
Thanks.
Thank you. If you like this video, don't forget to like, comment and share this video. If you want more insights on various aspects, please log on to ET Edge Insights.